Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the HIMSS conference, interviewing the industry's greatest leaders about trends in the space. So tell me, who are you and what do you do?
My name is Lafe Bauer. I serve as the Vice President of Post-Acute Services at University of Maryland Medical System. One of the greatest leaders. I would not attribute that characteristic to myself, but I
Very
appreciate you speaking with me
humble,
today.
very
Yeah,
humble. You're truly an innovator in your space.
appreciate
So
that.
tell me, what trends are you hearing in the hallways here?
Sure, there is a lot of disruption that is going on in the environment. We know that there is everything from payer implications, regulatory changes. When it comes to the reimbursement system from the federal government is highly impactful at this time. Technology is causing radical shifts very, very quickly. And ultimately, there are hundreds, if not thousands, of startup companies and other established firms that are trying to get ahead of all of the challenges that have been in our environment for the past many, many decades. And ultimately, it's going to be very interesting to see in this very dog eat dog environment where there is so much disruption happening is who is ultimately able to bring about significant radical shifts that can ultimately drive improved quality of care, minimize cost, and it can be scaled in a large setting across the nation.
I'm asking a lot of leaders here about health equity because I don't feel
Mm,
like it's being talked out
mm,
about enough. And so,
Sure.
what do you feel is an underrated health equity challenge right now?
Sure. I would argue that the number one challenge that we have in our healthcare system, and this is not a unique new trend, it is the fact that we have not effectually dealt with end of life in our country. We do not effectually prepare patients, families, or otherwise for the fact that death is part of life. And how do we effectually prepare a family for all of that and talk about optimizing the quality of the time that they have? Making sure that we are addressing the psychosocial needs as well as the symptom needs that patients are facing in those final days, weeks, months of life, so that we can really drive quality over a perceived sense that we just have to keep trying something. How do we really support that patient and the family and really help them understand how to cope with, deal, and make good informed decisions at end of life?
Great perspective. Now, we have a lot of young people here at HIMSS looking to
Absolutely.
get into health IT.
Sure.
If you could give your younger self a piece of advice, what would you tell yourself?
Don't take yourself as seriously as you think you need to. All too frequently, we are constantly trying to strive to impress others and make people believe that we're worthy. Just believe that in yourself. People are far too focused on their own thing and trying to impress others to worry that much about you. So take yourself less seriously. The other bit of wisdom that I would say is, look, the old axiom, the old knowledge of have the serenity, the acceptance of the things that you cannot change. Have the strength and the courage to address and change those things that you can, and hopefully have the wisdom to tell the difference, and battle when you can and accept when you can't.
Great advice. Thanks for joining me
Of
today.
course, thank you very much.